Good afternoon and welcome to Congressman Darren Soto's Coronavirus Telephone Town Hall for Seniors. My name is Shayla, Congressman Soto's District Director, and I'll be moderating today's call. Thank you for taking the time to join us. We hope you find this call informative. This telephone town hall provides a safe way for you to speak with Congressman Soto one-on-one amid this rapidly evolving outbreak. Before we begin, I'd like to invite you to visit our website for up-to-date community resources to help you and your loved ones get through this crisis. Visit www.soto.house.gov and click on COVID-19. In a moment, I'll turn the phone over to Congressman Soto for some opening remarks. But first, I want to explain the format for today's call. If you would like to ask a question, please press *3 on your phone and you'll be connected with a staff person who will take your question and get you into the queue to speak directly to Congressman Soto. We hope to get as many of your questions as possible during this call, so we ask participants to limit their questions to one each. We are also limiting questions to those pertaining exclusively to the coronavirus outbreak at this time. Due to the high volume of questions, we won't be able to get to all of them over the next hour. However, we will have an opportunity to leave a message for Congressman Soto after the call is complete. Again, press *3 if you'd like to ask a question. Congressman Soto?
Good afternoon, everyone, and thank you for joining us in our coronavirus telephonic town hall. I know many across the nation, including in Florida's 9th Congressional District, are worried. We're facing a tremendous crisis, and it will require a tremendous response. So I wanted to take a moment today to keep you all informed and have a frank and forthcoming discussion in a way that everybody can understand the facts, the actions, and the background surrounding the coronavirus pandemic. I understand that many families across our district, Florida, and the nation, and especially our seniors, will be affected by the coronavirus either directly or indirectly. Many will face painful job losses as a result of the economic fallout, and many will be looking to not only each of us in our community, but to the Congress and others to help. And therefore, we are there today to help with these many issues and questions. I'll be joined by a list of experts that will be introduced after our intro, including Steve Neerman, President of Baycare Winter Haven Hospital, our Commissioner of Agriculture and Consumer Services, Nikki Freed, Ann Clausen, CEO of Central Florida Healthcare, Nassim McPherson James, Assistant Orange County Health Department Director, Len Gaminsky, United Auto Workers Retirees from Winter Haven, Maddie Rose, retiree and trustee from the National Association of Letter Carriers, both of whom will talk from a senior's perspective, and Christina Martin Fervita from the Social Security Specialist Department from AARP. Let's start with the statistics. And we recognize each of these cases, each of these are people in Florida and across our nation. In Florida, we've seen over 430 cases as of this morning, over 14,000 cases across the United States, with 218 deaths and 125 people recovered. And it's doubling daily. The U.S. Center for Disease Control and Prevention, the CDC, estimates that as many as 160 million to 240 million people could be infected by the coronavirus, with between 200,000 to 1.7 million deaths if we don't take control of this crisis. We could see as many as 2.4 million to 21 million people requiring hospitalization, but have only 925,000 staffed hospital beds nationwide. So as you can see, this is not only just about folks in need, but the capacity of our nation to be able to handle it. In short, our healthcare capacity could be overwhelmed, which is why we all need to work together to bend the curve on coronavirus to save lives. Congress is doing our part, as I will discuss in a few moments, and we need every American to do their part as well through staying home when you can, telecommuting when you can, and social distancing, as well as washing your hands, going to see your doctor, getting tested, and every other thing that you have been hearing about over the last few days to help what you need to do to keep you and your family safe. Let's now go to some facts about the coronavirus itself. It's transmitted through droplets or little bits of liquid, mostly through sneezing or coughing. These can be breathed either directly or by another, or can land on a surface and be detectable for up to 24 hours. And in a few rare cases, it can remain airborne, suspended for hours. You can be sick from the coronavirus, otherwise known as COVID-19, for up to 14 days before developing symptoms. These symptoms would include fever, tiredness, dry cough, and difficulty breathing. And it's at least 10 times as deadly as the flu. 80% of the people, though, will be able to recover without needing hospitalization. But we know many of the folks who will need hospitalization will include our most vulnerable, such as our seniors and people with serious health conditions. This is the reason why we are having this coronavirus town hall specifically focused on our seniors, to make sure that those of us in our community who are most vulnerable to this disease will have the information first and foremost. But we also found out over the last few weeks that young people are more vulnerable than initially predicted. 1/3 of the U.S. coronavirus patients are between 20 and 44 years old. As of the last couple of days, the Florida Department of Health and our state Surgeon General has set out outlines about who will be prioritized for testing, and we'll go into free testing aspects in a little bit. First, it is for folks who have had coronavirus symptoms within the past 14 days and meet one of the following factors: international travel in an affected area, domestic travel in an affected area, close contact with someone with COVID-19 for a prolonged period of time, someone who is 65 years old or older, an individual with serious health issues, those who are hospitalized with lower respiratory diseases, and by physician request. Next, I want to move to what congressional action has happened so far. On March 6th, we passed the coronavirus funding package, the first of 2 bills that have already been passed into law, with a third that we expect this coming week. In the coronavirus funding package, we provided over $8.3 billion. This included $7.76 billion for federal, state, and local agencies to combat the coronavirus, $3.1 billion for the U.S. Health and Human Services Agency to develop a vaccine, purchase personal protective equipment that we're hearing referred to as PPEs, and to help community health centers in underserved areas. They also include several other initiatives in the funding package: $950 million for the CDC to assist with state and local health responses within 30 days, to hire new personnel, to purchase new equipment and gather and analyze data to care for patients and track the surge of the COVID-19 virus. $300 million will be used to supply more vaccines and development of treatment. $125 billion will be used to help in the international response to fight the spread of this pandemic globally, and $500 million for waivers for Medicare telehealth restrictions. This waiver for Medicare telehealth restrictions will help more seniors to have access to health care from your homes, and particularly help also those in rural areas. Then last Friday night, we passed the Families First Coronavirus Response Act, which just was signed into law 2 days ago after the Senate finally passed the bill coming out of the House. This was negotiated between the House Democrats and Secretary of the Treasury, Mnuchin on behalf of the Trump administration. And it provides for 5 key areas: free coronavirus testing for all Americans, including the uninsured, to ensure we can identify all those Americans with the disease, treat them, and prevent them from spreading the virus to others. It gives workers 14 days of paid sick leave and up to 3 months paid family and medical leave to ensure everyone affected by the coronavirus can care for themselves and their families. This is the first time in our nation's history that we've had paid sick leave and paid family leave in federal statute. It provides enhanced unemployment insurance for workers who are furloughed or lose their jobs due to the economic slowdown. And just recently, we've asked Florida to increase the woefully low $275 per week that employees get under unemployment insurance once they lose their jobs. Fourth, it strengthens the food safety net, including key senior nutrition programs like Meals on Wheels. It also helps with our young people through student meals, families through SNAP and food banks to make sure no one goes hungry during this crisis. And finally, it increases Medicaid funds to states to guarantee that Florida and other states have the funds they need to handle the surge in healthcare costs. During the meantime, over this last week, we've led several letters. I'm honored to serve on the Energy and Commerce Committee, which basically regulates most Fortune 500 companies and has authority and jurisdiction over telecommunications, energy, and other key life-saving resources. I led the first letter to the Federal Communications Commission, the FCC, to ensure that no family has their cell phone, landline, or internet turned off during this national emergency. With so many people working from home, relying on the internet, relying on cell phones for their lifelines and their landlines to communicate with the outside world for key information about this crisis, it's key that we keep cell phones, landlines, and internet running for all Americans who have it. The second letter we're leading on is to the Federal Emergency Management Agency, FEMA, along with the Florida Department of Emergency Management and the Florida Public Service Commission, to ensure that no family has their power, water, or waste services turned off during this national emergency. We know how key the power will be for all these folks who are asked to stay home and telecommute and stop the spread of the coronavirus. Clean water, absolutely critical to make sure that people can stay healthy, and waste services. And finally, we're also leading a letter this week to bring home so many Americans who have been stuck abroad because of the travel restrictions. Also during the interim, 1 week ago, President Trump finally declared a national emergency. This will allow FEMA to utilize the $43.6 billion available in the Disaster Relief Fund to assist state and local governments in their efforts to mitigate the spread of coronavirus and protect public health. It has expedited the flow of response teams and assisted the National Guard as well as the flow of equipment. It also has an allowance for what we call 1135 waivers to waive and modify requirements for Medicare, for our seniors, Medicaid, for our needy families, and the Children's Health Insurance Program, CHIP, to make sure that we're covering all aspects of the virus. In addition, 2 days ago, the Defense Production Act was finally invoked by virtue of this public health emergency. The act confers broad authorities on the federal government to mobilize domestic industries in the service of national defense, including our homeland security, stockpiling, health security, space, and any directly related activities under the Stafford Act. This will finally boost the order, production, and distribution of healthcare supplies. We have seen there are not enough coronavirus tests. There are not enough personal protection equipment for our first responders. There's not enough key healthcare supplies, and this will finally get all industry on the same page. The Department of Defense also has made 5 million respirator masks and other personal protective equipment available including 2,000 ventilators. While this is not nearly enough to meet our nation's needs during the coronavirus pandemic, it will help states and health systems to better combat this crisis, along with many of our local hospitals that are helping out with the testing, along with other testing groups like Quest and LabCorp. Next week, we face the third big challenge, which is economic relief. We will return to Washington, and we intend to go big to combat this unprecedented pandemic and economic crisis. Potentially hundreds of thousands of Floridians, even millions, could lose their jobs in the short term, especially those in tourism and service industries. Many small businesses could go under, and some large businesses too, and they need our help. First, we will focus on job retention relief. We will provide direct financial assistance to help businesses, large and small, keep their folks employed. Help is on the way in the form of direct grants, payroll incentives, and other financial assistance. We will do all we can to keep people working and earning a paycheck because that's the right thing to do for the American people and for our economy. We will also continue to boost unemployment benefits for those who lose their jobs. We will work to expand those benefits for ineligibility to include those who work as contractors or in the gig economy. Florida will also receive a substantial amount of additional funds for our unemployment insurance program. So as I said earlier, they must use these additional funds to increase the weekly benefit from a low $275 per week to hopefully to at least $500 per week and increase the length of benefits beyond the 10 to 12 week limit that currently stands. Second, we will continue by providing free coronavirus treatment, drugs, and vaccines. It's not enough to just have the free testing that we just passed. Once people have the virus, they need the health care and resources to recover. Third, we must protect our first responders, our doctors and nurses, our police, our EMTs, and our firefighters, and increase our healthcare capacity. Our folks who are first responders are on the front line, and they need our help. This includes making sure they have sufficient personal protective equipment, temporary hospital facilities, and other assistance to keep them healthy and helping others. Fourth, we are debating how to roll out checks for individuals who contract the coronavirus and families who are directly affected by the coronavirus, and to those individuals who lose their jobs. We have seen the proposal by the Senate and President Trump, and we have responded by making sure we have a targeted program. We will be sending money in a targeted, more powerful way to make sure those who need it most will get that funding. Lastly, I want to talk a little bit about the Medicare and Social Security aspects of this. This original town hall was supposed to be geared towards Medicare and Social Security specifically, but given this crisis, we have converted to make sure we are getting you the information you need. First, Medicare should cover all medical costs associated with the coronavirus now that we've passed the Family First Coronavirus Response Act, especially the testing. But we need to pass the new economic package to ensure when we're talking about treatment, drugs, and vaccines under Medicare that there are no copays or additional charges. We know our seniors are most vulnerable, and the nation needs to step up, including the Congress, to make this happen. The National Emergency Declaration, as I discussed earlier, has the 1135 waivers, which will assist in these additional costs to Medicare. I did want to mention briefly that the Congress, or at least the U.S. House, has already passed the Lower Drug Costs Now Act, which is really key to discuss the fact that we need to lower drug costs beyond just this epidemic by allowing Medicare to negotiate drug prices, by limiting out-of-pocket expenses to $2,000, and allowing private insurance plans to take advantage of lower negotiated Medicare prices. Discussing briefly Social Security, the reason why the Congress did not do the requested payroll tax elimination that President Trump had initially asked for is that it would have cost over $1 trillion and destabilized the Social Security program, including payments to seniors, because that is the source of some of the funding. So we negotiated and came up with a bipartisan solution, and we'll continue to do that. With that, knowing that that is a lot of information, but wanting to make sure to keep you all informed, we're going to turn to our experts. First, we're going to hear now from Steve Nerman, president of Baycare Winter Haven Hospital, one of the many fine hospitals on the front lines of caring for our seniors and others during this coronavirus pandemic. And now if we could open the line for Mr. Nerman, thank you for joining us.
Thank you as well, Congressman. I appreciate the opportunity to speak to constituents and members of our community. Winter Haven Hospital and Baycare Health System are determined during this coronavirus issue to continue our mission to take care of our communities and improve the health of everybody that we serve. Our hospitals and our doctors have two main challenges, both of which we've been tackling relentlessly for many weeks. How do we care for the increasing number of coronavirus patients while also protecting our employees, which we call team members, physicians, patients, and the broader community from the continued spread of this virus? I can tell you what we are doing right now. For weeks, our leadership has been adapting our hospital operations to best respond to this coronavirus, including extensive work detailing, how and when to shift our resources and our assets to respond to the spread of the virus. Some of these strategies specifically are training our team members regarding proper protocol for diagnosing and isolating suspected cases, making sure we have the adequate supplies and particularly the personal protective equipment on hand, considering contingency plans for our hospitals and other facilities in our system. You may have noticed just this week at Winter Haven Hospital, we have put up tents in front of our hospital, in front of the emergency department, in the case that we have so many patients that we need to do screening and some treatment activities there as well. Part of this preparation has also unfortunately meant having to make very difficult decisions that are an inconvenience for our community. But each of those decisions has been made in the pursuit of the public's best interest for their health. Limiting hospital visitors, screening all visitors, and canceling elective surgeries and other elective services are some of those difficult but necessary actions. We have options for patients so that they can get the help that they need for coronavirus. We encourage the public to take advantage of Baycare Anywhere. That's an app on the phone where you can see a doctor and they can diagnose common conditions and illnesses without having to go out of your home and visit a healthcare facility. On Wednesday of this week, Baycare converted 7 of their Baycare urgent care locations into testing centers for the coronavirus. In Polk County, that testing center's on Highway 27 in Haines City. It's open 7 days a week from 9 a.m. to 5 p.m. for patients that meet the screening criteria defined by the Center for Disease Control. Between Wednesday and Thursday of just this week, we screened 203 patients at that site, 104 of which qualified to have a collection of a specimen to be taken. I can point you to our website, baycare.org/coronavirus. It's updated every day, sometimes several times a day. We're committed to keeping our communities informed. The government has been a helpful partner in Congressman Soto as well. We're grateful for their continued interest and support that they've shown, specifically Congressman Soto and the leaders in Washington, D.C. We're in regular, frequent contact with others at local, state, and federal levels, and we appreciate the interest they've shown in ensuring Winter Haven Hospital and our other hospitals have necessary resources to continue to take care of our communities particularly during unprecedented times. In fact, we have had several calls with local government partners to address how we can expand access to triaging community members and testing those who meet the criteria to be tested. We still have a long way to go, but we're encouraged by the conversations we've had recently with the Polk County Health Department and the Polk County Emergency Management Department. A number of the steps that Congressman Soto has already taken have been very helpful, including supporting 2 coronavirus spending bills that address a number of emerging needs, such as the provision to expand access to telehealth so that you can use your phone to see a doctor rather than have to go to a facility. As we continue to combat the coronavirus outbreak, it's important for Congress to remain in close contact with the hospitals and the other healthcare organizations and doctors to ensure that we address these needs, such as critical medical supplies and personal protective equipment. Finally, I'd like to again thank Congressman Soto for the opportunity today to address this significant concern that is affecting nearly everyone in our community. Thank you.
Thank you, Mr. Neerman, and please pass along my thanks to your doctors, nurses, and other healthcare professionals on the front lines at Baycare, Winter Haven, and across the Central Florida and Tampa Bay area. We have their backs, and we're going to do everything we can to help them and their families. Next,
yes,
thanks so much. Next, we are so very honored to have our Florida Commissioner of Agriculture and Consumer Affairs, Nikki Fried, on the line, who took the time out of what is undoubtedly a busy schedule statewide to be able to help. With that, Commissioner Fried, if you would like to address us, thank you so much for being on the line.
Thank you, Congressman Soto, again for hosting today. I'm Nikki Fried. I'm your Florida Commissioner of Agriculture and Consumer Services. We all share this growing concern over coronavirus, but I want everybody to know that we're in this together. Be assured that we're doing all that we can to keep you safe during these challenging times. And just want to share a few steps that the Florida Department of Agriculture and Consumer Services is doing to minimize the threat of coronavirus for consumers, bankers, and of course, keeping our children safe and fed during these disastrous times. So basically, I want everybody to realize that we regulate over 40,000 grocery stores, markets, convenience stores, gas stations, and have sent guidance to them over best practices to make sure that we are reducing the spread of coronavirus. Including in some of those provisions is to make sure that they are using wipes at all of the stations on the keypads and nozzles, as well as on the grocery stores, all the baskets that we handle. There's about 2 places that millions of people reach every single day that we're making sure that they're following specific protocols. I'm also reminding businesses that all employees must comply with the state rules of hand washing before and after preparing food. That's also of handling raw food and touching of garbage in any sort. These are just basically precautions and things that they should be doing already, but just constant reminders. And also goes to the consumers as well. Make sure that you're disinfecting commonly used surfaces, you're cooking food to recommending temperatures, regularly washing your hands or sanitizing them. Again, these are just reminders of things that we should be doing already, but just making sure we're taking those extra precautions. Our agency also funds Florida's $1.3 billion of school lunch program that serves 245 million free reduced lunches to our 2 million kids across the state. So we're ensuring everything that we can to make sure that we're continuing to provide these meals with the school closures. We have activated our Summer Break Spot website, our call center, as well as our text line to help families find free meals for children during the COVID-19 school closures. So to find the closest location, you can text FLKIDSMEALS. That's Florida. That's FL Kids Meals, and that's to 211-211. Or you can also call 211 to speak with live operator 24 hours a day. And also visit our Summer Break Spot website, which is summerbreakspot.freshfromflorida.com. We also have over 1 million low-sodium emergency meals for seniors for community group distribution. I've also been in constant communication with Publix and their CEO this week to assure you, and I'm just in here loud and clear, that the food supply chain is steady. We do not see any disruption in the food supply chain, so there's no need to hoard foods. In fact, when you do that, you're making it harder for elderly and those compromised. And as of yesterday, Publix even announced that every one of their stores across the state from 7 to 8 o'clock is going to be able to provide that additional hour for those with compromised immune systems. So want you all to know that the food is also safe. Per the FDA, there's absolutely zero evidence that COVID is transmitted in food, but also, again, precautions. Please make sure you're washing your fruits and vegetables. And for seniors in particular, please take advantage of the senior shopping hours and also make sure you're, again, wiping their carts and basket handles. From Central Florida and beyond, we're in this together. From here on, we're going to be with you every step along the way. And for continuous updates on what we are doing at the Department of Agriculture, you can follow us for our updates on Facebook or Twitter at FX, or go online to fdacs.gov. And again, thank you, Congressman Soto, for your leadership on this issue. And know that we are here. And if there's any concerns or questions, please tell your constituents that you have absolute access to us, and we'll be here every step along the way.
Thank you, Commissioner Freed, for all your help to our office and for all the work you're doing to make sure that our seniors, our children, those vulnerable communities are being fed through this crisis, and to make sure that no Floridians getting price gouged through your consumer service vigilance. We really appreciate your leadership and taking time out of your busy schedule as you're going statewide to talk to Floridians from Key West up to Pensacola and around. So thank you for being here, and thank you for your leadership. Next, we have Ann Clausen, who is the CEO of our Central Florida Healthcare Clinics. Ann, thank you for being here.
Thank you so much, Representative Soto, for having me on the call today. Congressman Soto, I appreciate it very much. It's a pleasure to be able to have the opportunity to talk for a few minutes. Central Florida Healthcare is a community health center, and we have over 13 clinics in Polk Highlands and Hardee County, serving over 55,000 patients. We, as everyone else, has been affected by this coronavirus, and we're working diligently day and night to make sure that we have everything in place to be able to continue to take care of our patients and also take care of our staff. So a lot of work is in place, and we're working with the Florida Association of Community Health Centers, the National Association of Community Health Centers, the CDC, and HRSA, just to ensure that we are following all the guidelines. We did have the first patient that was affected by the coronavirus in one of our clinics. That was the first one in Polk County. We had all measures in place to ensure that we had our patients safe, our other patients in the lobby, our staff, and our medical providers following all the recommended CDC protocol. So we, again, as Steve Neerman said, are working diligently to make sure that we are following all the guidelines. We do treat all people, so we are open to see anybody. We have testing kits. We are testing patients. We're testing our staff as needed, working very closely to get those test results back, and then following the appropriate protocol if any patients were to test positive. So again, we have pharmacies in place, and we're changing a lot of our procedures and guidelines to be able to do anything that we can that's somewhat out of the normal to be able to take care of our patients. A lot more deliveries with our pharmacies for medications. We are calling all of our patients that are over age 65. We're working with our case managers, our navigators, and being able to do anything that we can to help our patients. We also have a director of behavioral health and counselors that are in place for our patients and for our staff, because we know how important, as we go through this period right now, the behavioral health aspect is equally important, not just to the physical well-being, but the mental well-being of our patients and our staff. So we we're on the front lines and we are responsive. I'm very proud of our leadership, that we've been able to shift resources and just have all of our 440 employees work together as a team to be able to take care of our communities. So I thank you very much again for allowing me to talk, and I appreciate all the efforts that you are doing, and all of our government officials to ensure that we work on this together, and hopefully we'll be able to see an end in sight soon. Thank you very much.
Thank you, Ms. Clausen, and thank you. Please pass on our thanks to the doctors and nurses and other healthcare professionals working on the front lines there in Central Florida health care clinics in Polk County and beyond, for all that you all are doing for our seniors and our vulnerable families. We appreciate you.
Thank you very much.
Thanks so much. Next, we have Nassim McPherson James, the Assistant Orange County Health Department Director. Thank you so much for joining us.
Good afternoon, Congressman Soto and everyone else on the call. Thank you for inviting us to participate. The Department of Health wants to mimic pretty much everything you've heard prior to me. We want to encourage everyone to be practicing universal precautions. Right now, there is no projected treatment for this disease, and so the best way is to prevent. And to prevent, we want to ensure that everyone is avoiding close contact with anyone who may be sick, covering up the cough and sneeze with tissue, and then ensuring that we're disposing of those tissues properly, avoiding touching eyes, nose, mouth, and those areas, cleaning and disinfecting all surfaces as needed and frequently, and staying at home when you feel sick, and ensuring that you're washing your hands, especially if you are sick or have been around anyone who is sick. I want to mimic and encourage that all of our senior population to take advantage of those hours that have been designated for shopping, the early morning hours, to avoid being in close contact. And we are encouraging that no one attend any mass gatherings or any gatherings that are more than 10 people. The Department of Health in Orange County has recently provided a hotline for residents in Orange County who have questions or would need to be screened over the phone. And that telephone number is 407-723-5004. The state of Florida, or Department of Health, Florida, also has a hotline, and I'll provide that number. That is 1-866-779-6121, and that number is for anyone in the state. The Department of Health in Orange is currently in the process of preparing a testing site, and we hope to announce that information next week, where we would screen individuals who meet the CDC guidelines and CDC criteria, and then bring them in for testing if they do meet criteria. And I want to reiterate again, what is that criteria that we're looking for? If you believe that you have symptoms, please give us a call at those phone numbers. What are the symptoms? Looking for fever, 100.4 or higher. Are you coughing? Do you have shortness of breath? And when you call those numbers, expect to be screened by our telephone customer service representatives, and they will ask, have you been in close contact with anyone who is a confirmed case of COVID-19? Have you traveled recently to one of the affected regions? Have you traveled internationally or been on a cruise anywhere? Are you over the age of 65, and are you immune compromised? If you meet some of those criteria, you will be transferred to our epidemiologists, and they will further assess for any risk and then give you further direction. And we want to encourage, if you have any symptoms or have any questions, to please reach out to the statewide hotline. I'm going to give that number again just in case you didn't get it, 1-866-779-6121. 6121. And if you are in Orange County and would like to reach out to the Orange County local hotline, that is 407-723-5004. Again, practice good universal precautions, good social distancing, and if you fall in those high-risk categories, ensure that you're calling your doctor if you notice any symptoms. If you need to be transferred to the emergency room, if you or someone else that is going along with you could call ahead at the emergency room so the emergency room knows that you're on your way. And that is it. Thank you all for allowing us to provide that information, and I'll turn it over to the next.
Thank you so much, Ms. McPherson James, for that very thorough explanation of what we need to be aware of. As I mentioned early in this teletown hall, we initially had planned on doing a senior town hall focused on Social Security and Medicare in Winter Haven in person. What a difference a few weeks makes. But we still are very excited to have Len Gaminsky from our United Auto Worker Retirees, representing UAW retirees across the state of Florida, to talk a little bit about how our seniors are faring and what they're experiencing and how we can help. Mr. Gaminsky, thank you so much for being on the call.
I want to thank you very much, Congressman, for putting this together today. Most of the seniors are handling this pretty good. You know, at the drop-in center, we noticed that people aren't getting out like they have been, and everybody's heeding the warning of not being around people that are sick. We appreciate everything you're doing for us, and the UAW, we're taking every precaution that someone don't get sick. We did have to cancel our meetings. We canceled this month and next month to make sure that there isn't contact with anybody that might be sick. And we're doing everything in our power so that all our members come out of this very good. So I want to thank everybody out there and everybody that's working to try to help us to get through this crisis. Thank you very much, Congressman.
Thank you, Mr. Gaminsky, and please extend my thank you for all the hard work that our UAW workers have done to help build America over the years and keep us mobile. And I am excited to say that part of the recovery effort long-term will be working on a nationwide infrastructure package to help bring people back to work, including fighting to get the Beyond I-4 Ultimate package into an infrastructure plan. We'll be doing everything in our power, which will help with a growing region and the traffic that people face once things are back to normal. Next, another one of our great friends, trustee with the National Association of Letter Carriers, Maddie Rose, has joined us to talk about some of the experiences that our seniors around Central Florida are experiencing, both in Nowcrest and Polk County and beyond. Mr. Rose, thanks for joining us.
Thank you, Congressman. I appreciate the opportunity. I first want to identify what my title is. I am the AFL-CIO representative for letter carriers across the state of Florida from the Florida State Association of Letter Carriers. I'm also the president of the trustees of our union retirement facility about 10 miles east of Lake Wales in Polk County, Florida. We have 500 low-cost apartments for our retired union members. And what we've done is similar to what the previous speakers have done. We've really closed down all our facilities at the Nowcrest Foundation. We've asked all of our residents, 55 and over, to practice all the safety provisions that have been directed by the Center for Disease Control and other organizations. Most of our members at the Nowcrest community have been cooperating. and adhering to what we have suggested to do. We've kept one of our facilities open at a very limited on a very limited basis. That's the laundromat. So a few people at a time could come and they can sanitize their clothes, their bedding, and other items that require machine washing and drying. We have not laid off any of our employees. However, they've been given certain specific safety concerns that they must follow. We also started today a takeout lunch program with some prepared meals where our residents can come to our facility and pick up a takeout lunch at a very low cost. We're considering continuing that in the future on a regular basis. I also want to talk a little bit about the veterans at our facility. We have over 235 veterans, and of course with the VA closing most of their facilities only for emergency services, a lot of the appointments at the VA have been canceled. So we are keeping an eye on our veterans and their needs also. I want to shift and talk a little bit about, I'm a retired letter carrier and a senior, and I want to talk about what the United States Postal Service and the National Association of Letter Carriers, our union, is doing every single day, 7 days a week, 365 days, regardless of what the crisis is. Letter carriers are delivering mail. We're the only agency, federal agency, that has our letter carriers not working from home. They're getting your mail every single day. They're picking up your mail. They're making contact with millions of Americans across the United States. And that's one sacrifice that no other federal agency is doing. So when you get your mail and you get the support like we're getting from our congressman, please thank your letter carrier for doing that job. They have very limited protection, and our union, in cooperation with the United States Postal Service, is cooperating fully on trying to protect letter carriers when they're out delivering mail every day of the week. You can go to NALC, stands for the National Association of Letter Carriers.org, and the United States Postal Service.gov for further information. And I want to once again thank the Congressman for this opportunity to speak about those issues. Thank you, Congressman.
Thank you, Mr. Rose. And first, let me say, please extend my well wishes and for everybody to keep safe over in Nowcrest in Polk County. We're honored to represent a community of retired letter carriers. You all helped so much over the years to keep the mail running and to keep everyone from seniors to families to folks in rural areas connected in society. It's so important, and we appreciate the precautions you're taking over there to protect your folks. And thanks also for bringing up veterans. We have been in constant contact with our local VA hospital here in Orlando, which we're honored to have in the district. We have had communications as late as last night that they are in need of more personal protective equipment, and we are working with VA Secretary Wilkie and Chairman Takano of the Committee on Veterans Affairs to be able to help with these needs. And we will be here as the crisis subsides to help veterans who need to reschedule their appointments and have any issues. In fact, half of our cases at any given time are veterans cases, so we understand the need, and we're proud to serve those who have served. Finally, the Postal Service. I'm really pleased you brought that up. When we're talking about lifelines, like power and water, internet, we also need to talk about the importance that the Postal Service is in being a lifeline to so many seniors and families. the mail is more important than ever right now, as we're getting everything from important documents to packages that could contain life-saving medical supplies. And we know that our postal workers, our letter carriers are on the front lines as well, making sure that everybody can get these important deliveries. And we're so very grateful to them, and they will be part of the package that I spoke in broad terms about, to make sure that they have what they need to continue to do their jobs so that every American can continue to have their right to the mail as protected under our Constitution. Finally, but last but certainly not least, we have Christina Martin-Fervita, the Social Security Specialist from AARP, to talk about everything from Social Security to what our seniors are facing right now. Ms. Martin-Fervita, thank you so much for joining us.
Thank you, Congressman. And I would like to just say that we have 99,000 members in the Florida 9th, and we have been working so hard for the last couple of weeks as we saw this situation develop on behalf of all those members and other older Americans in your district and throughout Florida and the rest of the country. The spread of the virus across our country has obviously created a very stressful environment for all Americans, but especially older Americans. And I wanted to share first just a few things that AARP is doing. I know that everyone has talked about what they're bringing to bear in this fight, and I wanted to share resources with all of your listeners that they can take advantage of that we're providing. So the first thing I want to assure you is that we're actively engaged in our national response, but also our state-by-state responses to the outbreak. And we are trying on a daily, sometimes hourly basis to provide you with trusted information on our website, aarp.org. We're publishing in both English and Spanish information and tips about the virus, how to prevent its spread or avoid its spread, and other information that's relevant, including we're working really hard to make sure that all of our readers can keep up with all of the changes, many of which you have been detailing, Congressman, that are going on at the federal level, not just congressionally, but also at the agency level. There's so many changes that are being announced, again, daily, sometimes hourly. So you can find those daily updates at aarp.org/coronavirus. We're also hosting weekly teletown halls, much like this one, with the nation's top coronavirus experts. We're not the coronavirus experts, but we're very lucky that we can bring them to folks to listen to and ask questions. And we've done our best to bring the best people around the country to do that for all of you. And again, if you go to aarp.org/coronavirus, you can get call-in details for our weekly teletown halls, but also look at transcripts from the prior sessions. For example, our first session included the head of Medicare and Medicaid, and we've had top doctors from the CDC speak on these teletown halls. So we're offering that to everyone. You don't have to be a member. Anyone at all can listen into those. As with regard to Social Security, Congressman, we're continuing a lot of what AARP does. Is we are your advocate in the nation's capital and in every state capital. And we are working really hard to make sure that lawmakers are allocating sufficient resources to address the outbreak and address the concerns of everyone who's 50 plus. And Congressman, you've been a terrific champion and supporter of all of those efforts, and you've been detailing quite a lot of what you have been up to and what the House has been doing to address this situation. For example, with regard to Social Security, one of the things that I wanted to make sure that we underscored for your listeners, we have been supporting emergency aid payments to individuals and have been for a few weeks now talking to folks on the Hill to make sure that was not provided through a payroll tax cut or payroll tax holiday, because we don't want an emergency measure today to undercut Social Security tomorrow. And so we've been really clear about that, and we're pleased, just as you're a congressman, that everyone right now really is focused on doing individual checks or payments and not doing a payroll holiday. So we think of that as a big victory. We've pushed very hard to ensure that Medicare covers telehealth visits so that beneficiaries can consult with doctors without having to leave their homes, and I know that we've covered that on this call. So we've been doing a lot of Social Security and Medicare advocacy during this period of time. And currently one of the things that we're very focused on is that we know that the Social Security Administration has closed all of its field offices, and we know how important those field offices are to the communities, and we know how important Social Security is to everyone in their lives. And when you have a question and you need it answered, you often want in-person help. So we know that these closures are going to have a big impact, and we are working very closely with SSA, asking them to give us more information about how will they handle requests over the phone. What about folks who really can't take care of their finances online? How will they manage emergencies, of which there will be many there are many every day, but there will certainly be many more in the coming days and weeks. And so we're working really hard to get answers from SSA. We know that they're doing their best to prevent the spread of this virus, and we understand that's why they've closed their offices. But we also need to make sure they're accountable and are providing the best service to all of you, their customers, who have earned your benefit over a lifetime of taxes that you have paid into the Social Security Trust Fund. So some of the things that we're doing, I've detailed. I also want to talk about some of the things that we're not doing. We have, like many others have discussed on this call, we have suspended our events. We have a lot of in-person events that we're very proud of, like Movies for Grown-Ups, and also a lot of programs that are very helpful, especially this time of year, like the AARP Foundation Tax Aid program that lets anyone come in and get their taxes prepared for free. To protect our members, that's all of you, but also our staff and our volunteers, who are also all of your neighbors. We are following the guidance of the CDC, and we have temporarily suspended all of those in-person events. And when the time is right, we look forward to rescheduling all of those. And we also just want to finally say we understand that there are a lot of partner organizations in the community who are going to be addressing in a way that is new and challenging the isolation and hunger that will come with this extended period of time that we're all facing in our homes and in social isolation. And so we are really working hard to make sure that programs like Meals on Wheels have the support they need, and we have been supporting them throughout this crisis, and we'll continue to do that. So with that, I just want to thank you again, Congressman, for inviting us on.
Thank you, Ms. Martin-Fervita, and I did want to comment on a couple of great topics you brought up. First, we are supportive of emergency Social Security payments to help address this as part of the overall economic package that we are working on right now for next week. And I'm glad you lent your voice to the issue regarding the proposed payroll tax cut. Many of you may have heard President Trump propose this and then not get that idea into the package and may be wondering why. We compromised, all of us. And upon further study, both parties came together and made a decision that a payroll tax cut like that would have put the Social Security program in jeopardy. Checks to our seniors earned throughout a lifetime of paying into the program could have been in jeopardy by cutting the payroll tax or having a holiday. So that's why that wasn't done. And as we're looking at boosting up employers' abilities to keep people on the payroll, we won't be looking at cuts to it, but more grants and other direct financial payments to help them keep people working. With that, I'm going to turn it back over to Shayla for some important information about asking questions.
Thank you, Congressman Soto. Again, if you would like to ask the Congressman a question, please press *3 now. What the Congressman is going to do now is address some of the questions you have all submitted. Please remember, if you would like to receive more information on Congressman Soto's work during this public health crisis, please feel free to press star 6 at any time to sign up for his newsletter. Congressman, we're ready for questions.
Thank you so much, Shayla. And not only will I be answering these questions in order that we received them, but also queuing up some of our panel of experts to go into some of the responses as well. The first question is from Mr. Bob Skillman from Davenport, and he asked a very good question. When will we be done with this virus? Let me start initially by saying that our health experts have told us it could be weeks to months. But we know that if we bend the curve, if we do everything from have proper best practices for ourselves personally to social distancing to working from home to a profound and tremendous federal, state, and local response, that it will be over sooner. I don't think anybody could specifically tell you a time, but I do want to give Ms. McPherson James an opportunity to have some input on behalf of the Orange County Health Department about potential timetables or any information she may want to provide.
Thank you, Congressman. At this time, we don't have a set timeline for this virus. What we are trying to do, as you stated, is just flattening that curve. If we can stand up more prevention efforts, then we can hopefully shorten the time frame that we'll see this virus in our community and the time frame that we'll have to continue to alternate and alter our lives. But at this time, I can't speak to a definitive time frame. What I can speak to is just I know that all the efforts we've talked about today will, if we have every citizen doing their part, it will flatten that curve, and we will see that this virus, and we're able to handle this virus better.
Thank you for that, Ms. McPherson James. And we are all reminded that this is a national and international crisis. And I understand how many people are hurting right now, whether it is from contracting the virus or having a family member contract it, whether it's job losses, whether it's the huge inconvenience of having to stay in and around your home and travel only when needed according to CDC and Florida guidelines. It's also a test of our nation's fortitude and character. And like many generations before, from everything from World War II to the Great Recession, I have my every faith that every American has the ability and will do their best to help out together so that we can be done with this virus as soon as possible. Our next question is from Miss Ellen Underwood from Polk County. She asks, where is the one go-to website for information? What a great question. So first, we have already prepared on our house website a one-stop shop of local resources and federal resources and that is www.soto.house.gov. Again, that's www.soto.house.gov. We have made sure to prepare a one-stop shop of information. In addition, I want to give Ms. Clausen, followed by Ms. McPherson James, the opportunity to be able to talk about their websites. So first, Ms. Clausen.
Sure. We are ensuring that our website is up and current each day. And so we're going to make sure today that by the end of the day that we'll have all current information as well. And one other thing to add too, that we do have our call center line available. So any calls go into our call center and they're able to direct any patient calls and be able to answer those questions as far as to what clinic they should go to, if they need testing done. So all of that is current, and we will ensure each day that we keep it current. And we also have information out there on social media as well.
And that web page name again?
It's cfhconline.org.
Thank you. And
You're
Ms.
welcome.
McPherson James, the website and phone number for the Orange County Health Department as well?
Yes, thank you. So we want to encourage everyone to start with the CDC website. The most up-to-date and accurate information can be found there. And you also want to check out the floridahealth.gov website. That's www.floridahealth.gov/COVID-19. And if you find the Florida Health website, there's going to be tons of information on COVID-19, where you can go, some frequently asked questions and information for even businesses and healthcare providers.
Thank you so much. I also want to mention that we have our congressional office, district number for the Kissimmee office is 407-452-1171. You could also get information directly from my staff, again, 407-452-1171. Next, we're asked from Jessica from Winter Garden. Work hours have been cut, and how can I get assistance? What about my kids in school? Two very excellent questions. In the Families First Relief Act, we have now qualified those who are furloughed, those who aren't working, and pretty soon in this next act, those with part-time hour cuts to qualify for unemployment benefits. You can find all the information you need about unemployment benefits on our website, soto.house.gov, which will connect you to our unemployment benefits website in the state of Florida. We're also asking that they increase the amount from $275 to hopefully as much as $500. We also will be looking at those with financial offices getting direct financial assistance through this next economic package. Secondly, about kids in school, I have just had the opportunity to speak to our Osceola County Superintendent, Deborah Pace. I also am married to a public school teacher here in Osceola County, and I get how inconvenient and how tough it could be both on parents and kids having to stay at home when they're so used to going to school. First, for their learning, there will be distance learning. There'll be an ability to have devices for our kids to be able to learn at home. In the meantime, during this pandemic, Orange County has enough devices. We are working with Osceola and Polk County to get enough devices. Obviously, this is not an ideal situation. Also, keep in mind that if you go to your school district's websites, it will list all the different schools, and you could go to any one of them for food assistance for the summer meal program that we have for students that we have waived to now be up and running in Orange, Osceola, Polk counties, and others. Finally, it is my hope that this financial assistance through expansions in unemployment, raising the amount, and also through potential direct checks to those affected will help you with additional daycare expenses. But I'm also hopeful we can include in the package some ability for greater tax deductions or direct payments for those who have kids who require daycare. So we will keep you posted. Much of this will be the issues we will be debating for this upcoming package. Next, we have Ms. Sherry Fardink from Lake Wales. I'm an ill senior, and if I get this, how will I be tested? First, we expanded through this last bill that was recently signed into law an ability for, or actually from the bill before that, an ability for telehealth. So you have the ability now through Medicare to be able to meet with your doctor through either your computer or potentially even your cell phone, should you have that technology available. And your doctor might be able to diagnose you there to then refer you on to get tests, which obviously the nation is ramping up for right now. Unfortunately, they are behind in the Trump administration getting these out, but we passed this new bill that should help. In addition, there are other options, and I'm going to now pass it along to Ms. Clausen from the Central Florida Healthcare Clinics to talk a little bit about those other options for seniors, and then to Ms. McPherson James. Ms. Clausen, the question again is, I'm an ill senior. If I'm an ill senior and I get this, how will I be tested?
Yes, so as I mentioned earlier, we are screening all of the phone calls through our call center, and that is how we can identify if we have patients that have symptoms that warrant us to be able to test them for the virus. So that's the first step, is to call the call center and get that information. And then we, once we screen the patient, we find out where they live, and we have them go to one of our nearest clinics. And what we're asking that they do is make that phone call again, so not come into the clinic, but our staff will come out in the appropriate gowns and mask and be able to test that patient in the parking lot so they don't have to get out of the car. And then we are anticipating that it takes about 3 days right now for those test results to come back. And so then we are notifying the patient immediately when we get those test results.
Thank you, Ms. Clausen. And to Ms. McPherson James, again, the question is, I'm an ill senior, and if I get this, how will I be tested? If you wouldn't mind answering that as well.
Yes, thank you. And so to mimic some of what Ms. Clausen said, a similar process, you can contact us at the numbers provided, and I'll provide that one more time, 866-779. I'm sorry, 866-779-6121. You would think I would have memorized it by now. And our local number for Orange County, 407-723-5004. And you would be screened and determined. If you are determined to need further follow-up, our epidemiology team will reach out to you directly, and our epidemiology team would plan for further follow-up with you. If you need to go to the emergency room, we are just encouraging you once again to please let the first responders know if you're being transported by ambulance that you have the symptoms for COVID-19, and also let the hospital know that you are on your way, and they will meet you there. But call those numbers if you feel that you have the symptoms and signs of COVID-19.
Thank you, Ms. McPherson James, and I'm glad you brought up the importance of informing our first responders and medical professionals if you feel you have the symptoms. If you do not, then if you don't let them know, then they could be quarantined themselves, which would mean less first responders who can help out others. Ms. McPherson James, would you also mind talking about the drive-by testing opportunities off of iDrive?
So currently, I don't have all of the information on that. That is being handled through the federal government. There is a testing site that is being prepared at the convention center in Orange County. I don't have the details as far as the hours of operation and if they are doing pre-screening for that site. But what I can do is have our office prepare something and send that to you after this call.
Absolutely, and we expect it to open over the next few days?
My understanding is, yes, that it should open over the next few days. Now, our local site in Orange County, we are in the preparation stage, and we hope to announce that to residents of Orange County next week, that we will have another site for testing open. That site will be, the clients will still need to call and be screened, and then we would bring them into that testing site. But we expect that information to be available next week.
Thank you so much.
Separate.
Our next question is from Miss Joan Milton from Polk County. Where and what are the shopping hours for seniors? Will the post office have special hours too? First, as to the shopping hours, I know that our Ag Commissioner mentioned that there'll be a special, that there are special hours. We will make sure to get you those specific hours. As I'm looking here, maybe I might be able to find that out for you.
Congressman, I'm still on the phone. It's Publix has from 7 to 8 every morning.
Thank you so much, Commissioner. I had in my notes that you had to leave for another call, so thanks for staying on. I really appreciate you being on the call and answering that personally. To the next question, will post offices have special hours too? We will be recommending those. We have not heard that the post office will have special hours, Ms. Milton, but this is one of the reasons why we're having these town halls, to get people the opportunity to give us great ideas. So we're going to pass that along to make sure we can recommend our post offices have special hours. I'm writing it right now for seniors. So thanks for that great question.
Congressman, this is Matty Rose from the letter carriers. If I might add something to that.
Absolutely.
I just want to remind everybody that you can use the post office every single day with never leaving your home. You can order stamps on mail. You can print postage. The letter carrier will come by and pick up your package. They will deliver all your mail every single day without having to risk going to a post office. Currently, my understanding is that if you go to the United States Postal Service.gov website in your particular area, some post offices might have some limited hours, but most post offices are open at regular hours. But I encourage everybody to use the online and phone system to minimize putting yourself in jeopardy by having to go into any facility that has a crowd. Just remember one thing: you never have to pay a penny to have your mail delivered 7 days a week. All you need is a mailbox or a post office box.
Thanks for that, Maddie. And as Mr. Rose said, you don't even have to go to the post office. You can get things delivered directly to your house if that's more convenient, and we urge you to do so if you are able to. Our next question is from Ms. Terry Lou Boyd from Auburndale. She asks, has there been outreach to undocumented folks? Some may be fearful to get help or tested if they are sick. And then her second question is there temporary hospital rooms being built? Example, hospital expansions for people who don't have COVID-19. So first, let me start with the outreach to undocumented folks. First, we have been in contact with local farm workers associations. The Trump administration has suspended, upon Congress's urging, the public charge requirement that they were going to put down, which would require, which would inhibit people from becoming citizens if they utilize any federal benefits. But we will continue that outreach. This virus will affect everyone regardless of their citizenship status. And regardless of their citizenship status, they could pass it on to others. So we want to make sure everyone who feels like they have the symptoms can get an exam. And as to the temporary hospital rooms being built, I know that there has been some discussion about some of our cruise ships, since they're not being used right now for cruises, to serve as makeshift hospitals for those without COVID-19. So that can help build capacity. But I want to give Ms. McPherson James the opportunity to talk about any other potential temporary hospitals being built, as well as Ms. Ann Clausen. So first, Ms. McPherson James, any info on potential additional capacity?
Thank you, Congressman. So at this time, we have been in contact with our local partners to begin some of those conversations. Those conversations are in the beginning stages, and we currently don't have any plans. We are working through our Florida Department of Health, our connected health system, to ensure that we are involved in all of those conversations. And as soon as that information is available, we will make sure it's available to the public.
Thank you so much. And Ms. Clausen, any info on potential expansion of temporary hospital beds or clinic beds in Polk County?
I would agree with what Ms. McPherson has also said, that we're just working with the local hospitals and the Department of Health, and we are ready and available if we can use any of our locations to think differently about seeing patients. So not any additional information to add to that.
Thank you, Ms. Clausen. Our next question is from Joe Wolf from Winter Haven. How can I find out how many COVID-19 cases have happened by state? Is there any way to track how many cases are happening in my county or community? I believe the Florida Department of Health has that information, and the local health departments have it. But I also want to give Ms. McPherson James an opportunity to discuss that question further.
Oh, yes, thank you. So, yes, you are correct. The Florida Department of Health, the website I provided, floridahealth.gov, we are posting that information, updating it very regularly. We have the updated numbers twice per day listed on the website. At this time, there are 474 confirmed cases from Florida residents, 46 cases from non-Florida residents, for a total of 520 cases being monitored and confirmed. So if you check that website regularly, we will ensure that the information is up to date. Also, if you follow the Florida Department of Health on Twitter, typically the press releases will go to Twitter before they even go out to the public. So follow those two websites, and I know that the CDC is also providing links to different states on the COVID-19 response efforts in other states. I'm sorry, I need to mention on the website there is a dashboard that the department has added where you can select your county and see a breakdown of cases by your county. Hello?
Hello?
Sorry, we seem to have some technical difficulties. Stand by.
Oh, yes. So our next question is by Martin from Polk County. He states, my brother is a veteran. The VA says they do not have tests. Is that true? If so, when will they get some? So first, please thank your brother for his service to our country. Second, I have been informed they have some tests, and they're going through different fielding requirements. And from there, testing some folks, they have let me know that they don't have enough personal protective equipment. So we're working with them on that. However, please have your brother, or you could call on your brother's behalf, call our district office at 407-452-1171. Again, that's 407-452-1171, and we might be able to help him get a test. For those on the panel, please, a reminder to mute your phones if you're not being asked a question. We're getting some static here. Thank you for that great question. And again, please have him call our district office. We want to make sure that if he's showing those symptoms, that he has access to an exam. Next, from Mrs. Stewart from Winter Haven. Can the virus be transmitted through my mail? We have seen the longest the virus can stay on an object is about 24 hours for things like cardboard. So it's recommended that even with the mail that you're getting, if you can use sanitizer on it or some aerosol spray to disinfect it, that'll be helpful, and continue to wash your hands. In addition, it'd be great to hear from Ms. McPherson James about how long the virus could be on surfaces such as mail and even when people get things to go, food to go, and other things like that.
Thank you.
Ms. McPherson James? Yes.
Yes, I'm here. So currently, we don't have any definitive information that tells us how long the virus can last on surfaces, and that is information that is still being researched. We're waiting for that to hopefully come down in the guidance at some point. Most often, the disease is spread from person to person, and that's why all of the recommendations have encouraged social distancing and ensuring that when in situations with others, you are about 6 feet apart, especially if you don't know if those people are sick. The virus is transmitted through droplets, and those droplets can land in the mouth or nose of people who are nearby if someone is coughing or sneezing. So at this time, it's just unclear if by touching surfaces and objects that have the virus on it, what the transfer rate is and how long it can live. And so we are just encouraging that, you social distance as much as possible and wash your hands as much as possible, 20 seconds every single time. Sing happy birthday twice while washing your hands. Thank you.
Thanks so much, Ms. McPherson James. The next question is from Mr. Aurelio Valdez from Kissimmee. Is it true that the National Guard has been activated, and what are the chances of a lockdown? Governor DeSantis has declared an emergency, activating certain National Guard elements for different aspects that they may need. Some of you may have even seen National Guard helicopters flying around the state. That is a key decision that was made. And the chances of a lockdown, I am going to defer to our healthcare professionals on that. I can tell you the current order is to stay at home if you can. You employ 10 feet distance between you and others where possible, social distancing, that all bars and nightclubs have been closed. Social distancing is also employed at both restaurants, small businesses, and at our beaches. And restaurants need to be at most at half capacity. But to go into some of the other potential requirements and potential of a lockdown, we'll now defer to Ms. McPherson James again. And thank you for all your help today, Ms. McPherson James, on a lot of these really important questions.
No problem. So the information that I have right now is that the National Guard is assisting with any healthcare needs in the communities. I don't know what the status of the deployment is and if that reason is for a lockdown. I want to mimic what you just said. The direction that has been provided from our state government and our federal government is that we lock down those public places and bars and nightclubs to prevent the spread. And I'm not sure if the National Guard will participate in any efforts around that, so I can't answer to a lockdown. But that at this time we're hoping to flatten that curve and ensure that we can do all we can as individual citizens and organizations connected throughout this region.
Thank you so much. I know we're running a little over time. We're going to take 2 more questions and appreciate everybody's patience. The next question is from Teresa Thompson from Winter Haven. Can you get the regular flu and COVID-19? A great question. I'm going to defer to some of our medical professionals. Ms. Clausen, have you seen any information or any patients that may have both the flu and COVID-19?
We have not, but my understanding is yes, that is potentially a possibility to get both. And I would defer that also to let Ms. McPherson-James answer that question too, but my understanding is yes.
Ms. McPherson-James, if you want to add anything to the answer, feel free.
So we have not been able to confirm that information just yet. As with the virus, the assumption is that yes, you could have both. What healthcare providers are doing, they're ensuring that everyone who is tested meets the criteria for COVID, and my understanding is most healthcare providers are attempting to rule out the flu. And I want to remind everybody that we're still in the height of a pretty nasty flu season, and so if you still can get the flu shot, go ahead and get the flu shot and just practice universal precautions, because it could be possible. We don't have the definitive answer on that right now, but we want to operate under the assumption that you can have both viruses at the same time, and the healthcare providers will treat each individual appropriately.
Thank you so much for that explanation. We're going to end on this question and then wrap up, and then my staff will be getting back to each other constituent who sent in additional questions. Again, we went directly in order of when they were received. The last one, are people on Social Security going to get stimulus checks they're talking about? So I know we talked a little bit about how we want to make sure that there'll be emergency payments through Social Security to our seniors as already, and I'm going to give Miss Christina Martin-Fervita a chance to bring it home on that idea on AARP's proposals that we are seriously looking at, and then we'll conclude. Ms. Martin-Fervita.
Thank you, Congressman. So we are fighting really hard to make sure that the checks go to everyone, whether you're working, retired, unemployed, disabled. This is very fluid. It's being negotiated right now. I know the Congressman has flagged that there's a lot of hard work going on on Capitol Hill right now. The proposal we have seen overnight would include retirees, individuals on Social Security, anyone who's getting Social Security disability. And we want to make sure that as the negotiations continue, that everyone can continue to be included in those payments, and that the payments that go out to folks, regardless of their work status, can be as big as possible. So I think that we're trying really hard to make sure that not only is everyone included, but everyone is really getting the best payment they can access. It's in flux, and Congressman, really you should have the last word on that, since you're in Congress and know best what's going on.
Well, it's everybody helping inform us that keep us at the knowledge level necessary to be able to combat this crisis. I first want to thank all our constituents, especially our seniors who can make it onto the phone today for our coronavirus teletown hall. We know this is a tremendous crisis, and it will require a tremendous response. And you could count on us to utilize the information we received today, as well as throughout the last couple of weeks from constituents, health professionals, and others to meet this generational challenge. I want to thank our panelists for being on the line today. Commissioner Nikki Fried, we're so pleased to have her on the line for the whole call. She is our statewide elected Commissioner of Agriculture and Consumer Services, representative on the cabinet and a head of DAX, and so having her leadership on the line, we're deeply honored. To Mr. Steve Nerman, President of Baycare Winter Haven Hospital, we appreciate the great work they're doing to help our seniors and other vulnerable populations during this crisis. To Ms. Ann Clausen, CEO of Central Florida Healthcare, thank you for what you're doing in clinics across Polk County to help our seniors and other vulnerable populations. To Ms. Nassim McPherson James, the Assistant Orange County Health Department Director, we're grateful for your and Ms. Clausen's many saves today to make sure that people have all the information they need from the healthcare professionals. To our retirees on the line, Len Gaminsky and Maddie Rose. Len, I know we started with this being a Medicare and Social Security town hall, but I believe we still have met our goal of trying to help out seniors, and please give my regards to all of our United Auto Worker retirees across Florida. And Mr. Rose, please also give my regards to all of the good folks living in Nowcrest over in Polk County, and we will keep the Postal Service running and protect those postal workers to make sure that they have everything they need to be protected. And finally, to Ms. Christina Martin-Fervita, thank you for the great work that AARP does on behalf of seniors across the nation, including the 99,000 that are in our district. We really appreciate all the great work that you're doing. Thank you, everyone. Please stay safe. Please utilize best practices, and please continue to reach out to our office for any information you will need at www.soto.house.gov or through our Kissimmee office and other offices, 407-452-1171. Have a blessed and safe day, and this concludes our telephonic town hall.